Hello and welcome to the Throughthepain podcast. This is a place for chronic pain and chronic illness warriors to dare, dance, and dream through the pain. All right. So hello, everyone. Thank you for joining me for another episode of the Through the Pain podcast. Here today, I have the honor and privilege of interviewing someone that I pretty much look up to. She is the Patient Leader Network Associate Director of WeGo Health, and I want you to welcome the lovely Kristen Long.
Thank you so much for having me, Dima. I am so excited to be here. It's an honor to be on the show, and I'm really excited about today's conversation.
Thank you. So for those of you who don't know, I am a WeGo Health patient leader and advocate, and I've been promoting WeGo Health pretty much from the inception. I've been down for a long time.
Yeah, one of our original patient leaders, no doubt.
I love you guys, but for our listeners who don't know anything about WeGo Health, could you please familiarize my audience with WeGo Health?
Of course. So as you said, I am the Associate Network Director at Wiegel Health, and Wiegel Health is really a mission-driven company that connects healthcare with the experiences, the insights, and the skills of a patient leader. So, what is exactly a patient leader? It's basically a patient or a caregiver who is using their story to really empower others, to raise awareness, to build community, to really create change in patient landscape, like yourself. So a lot of our patient leaders refer to themselves as advocates. Some of them refer to themselves as influencers. But, really they are the individuals that are doing just that. They're leading the charge for change, And that's exactly why we call them patient leaders. So it's our belief that if we really want to change healthcare, if we really want it to be the landscape that we all dream of, the only way we can do that is if we work with these individuals, if we work with patients and get their voice at the table. So we connect patients with virtually across all condition areas, all platforms, with pharmaceutical companies, life science companies, agencies, startups, really all types of organizations across the healthcare spectrum that are really interested in bringing that patient perspective to the table.
Awesome. So why do you think it's important to have the patient perspective be brought to the table?
I love this question. I think if you look at any other industry, right, there's always a feedback loop, and you always ask the user, and based off what the user's feedback is, you make iterations to that product or service. And somehow that got skipped in healthcare, right? We don't always involve the patient. And so WeGo Health kind of raised a flag to this and said, if we really want a system that works for patients and works for individuals, that are doctors and healthcare systems and whatnot, we need to involve all the stakeholders, and a patient is just that. And from time and time again, the experiences we have with patients and clients, they raise so many flags that, companies might not have thought of. Small things like, how many times have you seen something gone out and, you realize that patients can't actually see that color in that community, or, they need text bigger in some cases, or those sort of things. It's just things that I don't think, unless you are the patient, you are not the expert and you don't have that experience. So really bringing that to the forefront, honestly.
Well, you raised a good point, and you spoke about patient leaders being stakeholders, especially in our own healthcare. Why do you think we're not seen as stakeholders?
Oh, that's a good question. I wish I had an answer to that one. It'd make this a bit easier, right? I think for a long time that when you think of healthcare as a whole, it's very easy to see patients as statistics or numbers, or it's a big business. But in reality, these are real individuals, and the products and services that healthcare makes is impacting them on a very real level. And so to really transition the thinking of the industry of, we can build a product and service and help them versus we can together build a product and service, I think is kind of the biggest challenge. And slowly, I think companies are starting to understand that more and see the importance, but it's definitely been, an education point from our point of view.
So I want to make a little transition here and talk about the WeGo Health platform. You guys have expanded upon the platform within like a year and some change now. I absolutely love it. Could you talk about the little bit?
Yeah, this is my excitement. This is where I'm passionate about. For a long time, the company was really focusing on and getting patient leaders these paid opportunities because that's the thing. We don't just want them at the table; we want them paid at the table. Because if you're a doctor, you get paid for your insights. If you're a patient, you are the expert. You deserve to get compensated. Okay. So, the history of our company is really providing these compensated opportunities for patient leaders, but we wanted to do something more than that. We really wanted to empower them on all fronts so that they could really start to become visible and get their voice heard, whether it was through us or through other organizations. So, as you said, 2018, 2019, we've really started digging deep in research, and we actually collaborated with over 1,000 patient leaders to just identify, the gaps and the biggest challenges of patient leaders. And what our research revealed was there were three major gaps. They needed a way to connect with other patients that were just as passionate as them. They wanted a way to learn new skills and develop new skills that could really help them as advocates. And they really, again, wanted access to those paid opportunities where they could actually collaborate with healthcare companies who are valuing their experience. So we took that research, and over a year, we kind of put together the Wiegel Health platform, which is now a one-stop shop for all of those challenges. And it's for existing patient leaders who have already established their journey, but, might be looking for new ideas. And it's also for someone just starting their journey that, has no idea where to start, but they know they want to share. So the platform offers, discussions, discussion forums, and a public patient leader directory where individuals can search and connect, brainstorm, share ideas. I mean, we're all advocating for different communities, perhaps, but we all can share our lessons and really learn from each other's campaigns to see what was happening. So that's kind of the first gap that we were filling in. And then something that we did roll out was expert-led courses. So these courses are specifically designed for patient leaders to really improve and enhance those essential advocacy skills. So everything from FTC guidelines for patient leaders to how to build a community through social media, to how to tell your story effectively and get it out into the press. So those were all courses that we created, hoping that, we could start to really provide them the development skills that they wanted. And then lastly, of course, as I said, we do host all of our paid opportunities there. So all our members get access to any opportunities where healthcare companies are really seeking to tap into their insights and expertise.
Awesome. And I do want to also talk about the awards.
The awards.
WeGo Health Awards has been going on. How long has it been since?
This is going to be like the ninth cycle of it. There was a time where it paused for 2 years. But yeah, it's the ninth cycle. It's actually going to be really exciting this year. We are actually revamping the entire user experience so that it is a better experience for everyone involved, a better UX, just growing the program. So I guess backtrack before I get excited, kind of where this all started is we were working with so many phenomenal patient leaders, and we understood the work they were doing was great. The clients we were working with understood the work they were doing was great, but we were like, how do we get these people recognized more? Like the whole world needs to know about these people. So we created the WeGo Health Awards, just trying to, elevate their story more, get their mission out there, and really recognize the work they were doing. Because I'm sure, you can attest to this, that not every patient leader is getting paid for all the time and effort they put in. They're most of the time not for running the support groups, they're running support groups, whether they're running Instagram feeds. All of that takes time, all of it takes effort, and most of the time they're doing it out of passion. So is always admirable to me. But that's kind of the root of the program, is to really recognize it. So we kind of 3 phases of the awards. They start usually every year in May. This year will be mid-May, and we open up with nominations, and anyone is welcome to nominate a patient leader. We have 15 award categories. So everything from best in show blog to best in show Twitter to advocating for another, because patient leaders aren't always patients themselves. Sometimes they're caregivers. But we have a variety of different categories that really just try to go along the spectrum of online advocacy and make sure that everyone has the chance to get recognized for the work they're doing. And then we give, the community the chance to endorse them. It kind of gives a People's Choice Awards feeling, but the ability to really show support for that patient leader for their work they're doing. And from there, we have judging where we go through all of the nominations. So last year we had close to 7,000 nominations. So clearly a lot of nominations. Our judges worked really hard in getting through those. And the first 2 rounds of judging are done from community members, fellow patient leaders. So again, bringing in that community People's Choice aspect. And then once we get down to our 5 finalists for each category, we have industry professionals, experts, a lot of clients within healthcare jumping in and really getting involved with the program and selecting a winner based off that. So those are kind of the 3 main phases, I suppose, of the program. But what's exciting is at the end of all this, we have our virtual awards ceremony where, we welcome all the nominees to join in online. We have Facebook Lives, we have Twitter chats, just a few days of celebration. And it's really to bring the entire community together because we have nominees from Brazil and UK and Africa, all over the world. So it gives us a chance to come together as a community and not only recognize the work that, the finalists are doing, but really just bring together the community as a whole and rally everyone up, remind them, what we're doing matters and what they're saying matters. And then we invite our winners to an in-person ceremony to really recognize the contribution they're making to the online health community. So last year, we actually got to go to Las Vegas. We attended the health conference, and health was gracious enough to provide all our winners with travel and accommodations. And we were able to bring about 13 of our winners. All were invited, but course, some weren't able to come, unfortunately. But we invited them to an in-person ceremony, and oh man, I get chills thinking about it, hearing their stories on stage. It's really emotional and it's really empowering. And I can't even tell you how many times after that ceremony that people from the conference, so healthcare workers were coming up to us and saying, oh, wow, this is why I got into healthcare. This is why I do the work I do, because of these people. And I forgot about it. It was just such a reminder that these real stories are why we do what we do in healthcare. And I think that's kind of the root of the WEGO Health Awards, is to really bring that human aspect to the industry and remind them there are some powerful stories out there that people are willing to share if we just want to listen.
And I do get nominated like every year.
Well, you're awesome every year. Yeah, no kidding.
The thing is, what I love about WEGO Health Awards is I'm able to see everyone come together. And I didn't know. I'm so ignorant to the fact that there's so many people that are like me and are going through something like me. We don't have to have the same illness. We don't have to go through exactly the same thing, but we have the same fight. And we're in this together. So every year I look forward to see all the nominations, and I look forward to seeing what people are doing, not only here in the United States, but as you said before, in Africa, and in Australia. I was excited to see all the work that was done there. And I think that's why I appreciate WeGo Health so much, because I feel like I'm a part of a community.
Yeah, I mean, I definitely think we hear an echo of that a lot throughout our community. I think it's very easy. I personally am in the mental health space. It's very easy to go head down and focus in your community. But in reality, like whatever our diagnosis is, we are all facing the same challenges. And as individuals who support communities, we need support too. And we need to be able to collaborate and brainstorm and share ideas. And I think WeGo Health Awards is a way that really starts to break those silos down and show you there are thousands and thousands and thousands of people out there sharing their story. And there's so much inspiration and so much value that you can really learn from each other.
Yeah. So my last question for you is, what would you say to a patient right now who is transitioning and wants to be a patient leader, but is having a hard time
Yeah.
One, because of their illness, and they see themselves as a patient and they don't really want to take that next step into a patient leader.
Yeah. I mean, again, as someone from the mental health space, personally, I always say your mental health is priority number one. And I will never lie to anyone when I say being a patient leader is a tough job. I don't know how you guys all do it, but you tend to give and you give, and sometimes it's hard to pull back and make sure that you have enough. But as long as you can make sure that your mental health and you feel okay, you're meeting your needs, that it's scary to share your story and it's scary to come out there, but vulnerability, I say, always brings connection. And as scary as it is to hit publish or do that first post, you're going to post it and someone is going to get impacted. And whether it's one person or 100, they feel not alone anymore. And that's simply because of the work that you were sharing. And I think the value in the community that we have at WeGo Health is you don't have to do it alone. You have about thousands and thousands of individuals to support you, to empower you, whether you want to share that post or ask an idea. I mean, there is a community behind you to support you as you start to transition into this patient leader role. I think that it is a scary first step, but most people who do it, I've been told that it's like the best step they ever took because it opens the doors to a whole new community of people that, you know, they get support from, but also that they can support and create that conversation that needs to happen generally in their community.
Awesome. Well, thank you, Kristen, for joining me. I really appreciate you. For any listener who is interested in taking that next step from patient to patient leader, please log on to WeGo Health's website. It's WeGoHealth.com. I will also leave that information in the podcast show notes. And once again, thank you, Kristen. Do you have anything else to say or anything in closing?
Just a huge thank you for taking the time. I'm so glad we got to chat. And as you said, I mean, if anyone is willing to share their story or thinking about it, odds are you should get out there. And of course, there is a community of open arms at WeGo Health, and we're ready to support and empower you in any way that you need.
Thanks again.
All right. Thanks.
For tools, merchandise, and additional information, log on to our website, www.throughthepain.org. This has been a Public Praise Media production.